here's the lateral aspect of the skull. What we find is just not too many remarkable structures, but still remarkable nonetheless. We find first, of course, our sutures that we have is the coronal suture and the squamosal suture of the temporal bone. And part of the reason why it's squamosal is because this area of the temporal bone is so flat, it kind of lays like pancakes. You can kind of see it here where it kind of like peaks up. You can see how thin that area is, and they lay over about a good, almost about a centimeter. And so that's why they call it the squamosal suture, because it's like two flat things laying on top of each other. So this is the frontal or coronal suture, and then this is the squamosal suture, and then of course you get the lambdoidal suture cutting across here. One of the unique things here is where you can find the other portion of the greater wing of the sphenoid kind of sitting out here, and then right about here, this is the place where all these little sutures come. It's called the pterion, thinnest place if you want to strike somebody and crack their skull. It's right here, right on the side of the head. And so what we also find is this large prominent structure, what we call the zygomatic arch, made up of two different structures, something what we call the temporal process of the zygomatic bone, this little guy right here, and then the zygomatic process of the temporal bone. And you can imagine, why do we call it that way? Well, because it would be ridiculous for me to call it the zygomatic process of the zygomatic bone, because which one is that? Is that up here? Is that up here? No, but if I said the temporal process of the zygomatic bone, meaning this portion of the bone that is going to the temporal bone on the zygomatic bone, well then of course you could identify it very clearly as this little guy. Same with the zygomatic process of the temporal bone, because yeah, sure, we have all these other processes of the temporal bone, and if we just name the temporal process, we don't know which one it is. But if I said the zygomatic process, the one that's going to the zygomatic bone of the temporal bone, then you know. And this is then forming this nice zygomatic arch, the whole thing. And then, of course, the squamous portion of the temporal bone, you can see this large hole for our hearing. That is the external acoustic meatus or external auditory canal. Both of them are the same. Find this big mass process right here. This is called the mastoid process. And then this little sharpened point, that is the styloid process. Sometimes they're much longer, sometimes they're very, very spiky because they're supposed to look like pen. So styloid or stylus is like the pen, Pentex stylus, whatever. That is like stylus for any kind of tablet device. That is stylus. It would be sharp like a pen. You can see also the pterygoid process or plate, the lateral one here. And other than that, the other side, you can see the alveolar margins. You can tell that this is a very, very young skull because, of course, there is a tooth there. And then the alveolar margins and then alveolar processes, and then you can see the tip of the anterior nasal spine. See the nasal bone, you can see a little bit of the lacrimal fossa, which is the shallow depression or groove by the lacrimal bone. And other than that, you can see the little bit of the external occipital protuberance, not too much on this skull because it's female. Otherwise, a male would have a big, long, kind of little death spike at the back of his head. But we don't see that here. So let's review. We have the frontal suture, or coronal suture, with the squamosal suture and lambdoidal suture. Here, a little area is called the pterion. We can see the lacrimal fossa. We can see the temporal process of the zygomatic bone, the zygomatic process of the temporal bone, the squamous portion of the temporal bone, the external acoustic meatus or external auditory canal, mastoid process, styloid process, lateral plate of the pterygoid plate, the the anterior nasal spine, and then we have the alveolar margin with the alveolar processes sticking up, and then the external occipital protuberance, which is not too prominent on this model.